My name is Teresa Knight. This is my physical assessment video part 1 for NE361. I have a 36-year-old male patient. We've already done the health history. Vital signs were all within normal limits. Patient has past medical history significant for trauma, bilateral lower legs, and also surgery on the left foot. I've already introduced myself to the patient and verified his name and date of birth. Michael, may I please, I'm going to be doing a full head-to-toe physical assessment. Is that okay?
Yeah.
Okay, so I've washed my hands. We can begin. We're doing a general inspection of the patient. There's no signs of cyanosis, no jaundice. Color is normal, and patient does not appear to be in any acute distress. I'm going to take a look at the hair. There is some uneven hair growth with some spots of alopecia in the back of the head and the frontal areas. I'm going to palpate the scalp. Cranium. This will be normal, no lumps or masses, any tenderness?
No.
Okay. Next, I'm going to ask you to wrinkle your forehead for me. Close your eyes tight. Clench your teeth. And puff your cheeks. Okay, symmetrical. I'm going to try to open your mouth. Good. Palpate your temporal arteries. Good, and I'm going to palpate your temporomandibular joints. Can you open your mouth for me? Open your mouth. Close it. Open it. Move your jaw side to side. No popping or clicking. Is there any tenderness?
No.
Okay, next we're going to palpate the maxillary sinuses. Any tenderness?
No.
And the frontal sinuses?
No.
Okay, very good. Next we're going to take a look at the eyes. So we've already done the Snellen eye test. Michael's vision was 20/20. So next we're going to have you cover one eye for me. Look straight at me and tell me when this comes into your vision.
Yes.
Okay, other side.
Yes.
Very good. Now I want you to focus on a spot behind me. And now look at me. Back behind me. Look at me. Behind me. Look at me. Let's focus on a spot back here. Look at me. On the spot. To me. Back on the spot. And back to me. Good. I'm going to have you check your extraocular eye movements. I'm just going to have you follow the stick. Okay, eye movements are smooth. There's no nystagmus. Next, I'm going to check the corneal eye reflex. Look straight here. Look straight at me. Good. And we've dimmed the lights. I'm going to check for accommodation. Very good. Pupils are equal, round, reactive to light and accommodation. Can you look up for me? I'm inspecting the structures of the eye. Look down. Okay, good. Next we're going to look at the ear. So I'm going to start with inspection. Here's our good position, symmetrical. Looking at the auditory medius. Good. We're going to palpate the auricles. And the tragus. Any tenderness? Any tenderness?
No.
Okay. And we have done the whisper test. Michael passed at 5 feet away bilaterally. Next, we'll take a look at the nose. The nose is symmetrical, good position, no lesions or discharge. Can you cover one nostril? Breathe in the other side. Okay, nose is patent bilaterally. Next, we're going to take a look at the mouth. Can you open your mouth for me? Okay, so we're inspecting the teeth. We're looking at the buccal mucosa, the gums. Lift up your tongue, one side and the other side. Okay, the floor of the mouth looks good, and the hard palate looks good. Say ah.
Ah.
Okay, the uvula and soft palate rise midline, and the tonsils are visualized. Can you stick out your tongue for me? Stick it out straight. Good. Tongue is midline and symmetrical. Next, we're going to do a gag reflex. So I'm just going to touch the back of your tongue with this tongue depressor, and it'll stimulate a gag. Very good. Next, we're going to do your neck and your throat. So I'm going to start by taking a look. Okay, no pulsations. Neck is symmetrical. The skin is good. I'm going to palpate your carotid arteries one at a time. Other side. And we're going to take a listen. And then auscultate each of the carotids with the bell of the stethoscope. Can you look over to the side? Hold your breath. Good, no brewery. Now look at this side. Hold your breath. And no carotid brewery. Next, we'll palpate the lymph nodes. So I'll start with the preauricular, the posterior auricular, the occipital, submental, the submandibular, the tonsillar, superficial cervical, posterior cervical, the cervical chain, deep cervical chain, and the supraclavicular. No swelling. Next, we're going to palpate the trachea. Trachea is midline. Good. Can you turn your head to the left for me? All the way. And all the way to the right. And put your ear to your shoulder. Other side. Look all the way up to the sky. All the way down. Good. So range of motion is good. Push my hand back. Push my hand down. Turn your head to the side. Turn your hand to the other side. Good resistance, so good strength in the neck. And can you shrug your shoulders? Good strength. We're going to go ahead and check out your thyroid. So I'm going to give you a sip of water. I'm going to feel your throat from the back, and I'm going to have you keep your head nice and straight, your neck extended. Take a sip and swallow when I tell you. Go ahead. Good. Thyroid palpated. No thyroid megaly, no nodules felt. Next, we're going to inspect the posterior chest. So we're going to look at his back. Shoulders are symmetrical. Muscles are symmetrical. Patient would normally not have a shirt on, so we'd be looking at the skin for color and lesions. Skin looks good. Next, we'll palpate the back for masses, lumps, or tenderness. Any tenderness?
No.
Okay, and we're going to palpate the spiny process. Any tenderness?
No.
Okay, good position on the spine. Next, we're going to percuss the costovertebral angle. Tell me if you feel any tenderness.
No.
Other side.
No.
Okay. Next, we're going to auscultate the lungs. Okay. Deep breath. Deep breath. Deep breath. Again. Again. Deep breath. Again. 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 And laterally, deep breath. And lateral, deep breath. Okay, lungs are clear, no adventitious sounds. We'll take a look at the AP diameters 2 to 1. We'll then back to the anterior chest now. Just breathe normally. I'm taking a look at the respirations. No difficulty breathing. Respirations are even. There's no accessory muscles being used. So I'm inspecting the chest for color and symmetry. Looking at the skin looks good. So now we're going to take a listen to the anterior lungs. Okay, take a deep breath. Good. Again. 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 Okay, we got one more. And one more on this side. Good. Now I'm going to listen to your heart for a murmur. So I'm going to listen at the base of the heart, lean forward. Good. No murmurs. Okay, I'm just going to turn the chair a little bit so it's straight up. Okay. Next, we're going to take a look at your shoulders, your arms, and your hands. So we're going to start off with your shoulders. I'm going to have you put your arms out to the side. Lift them all the way up like a jumping jack. Good abduction, and now back down to your body. Good adduction. Put them out straight forward and lift them all the way up. Good flexion and all the way back. Okay, good hyperextension. Next, I'm going to have you put your arms like this. Lift your hands up and down. So internal and external rotation. Now take your hands straight out. Turn them in. So good pronation and supination. Next, I'm going to take a look at your hands. So I'm looking at the color first. I'm going to take a look at the nails. Nails are short, clean, no ridges, smooth. And I'm feeling the joints of the hands. As I'm feeling the joints of the hands, I'm also noting the color of the skin on the hands, the temperature. The skin is warm and dry. Okay. I'm going to check for skin turgor. Good. And capillary refill on both hands. Good. Next, I'm going to feel the radial and brachial arteries. Pulses are strong, 2+ and equal. Next, I'm going to palpate the epitrochlear lymph nodes. There's no swelling. And we'll do this side. So pulses, brachial and radial. Strong and equal, 2+, and the epitrochlear lymph nodes. There's no swelling. Next, we'll take a look at the hands and the wrists. So put your hands out, lift your hands, push them down. Good. And now I'm going to have you try to push my hands down. Good. And now try to lift them up. Okay. Flexion and extension of the wrist with resistance is good. I'm going to have you spread your fingers for me.